The behavioral health system in New Mexico is truly broken. I have a friend who, his son has been going to a program for 19 years, and that's no longer going to be covered by Medicaid. He's just one of many that are experiencing difficulties because of the lack of services that are available.
I've been to like 4 different hospitals, behavioral hospitals, and they were like all the same to me. They would constantly change drugs or medication, and it would just make me feel like really like sluggish and like maybe didn't want to do anything.
For me, I feel like there's nothing. I don't feel that there's services right now that meet my needs.
There aren't the degree of services, the range of services. There's obviously a real need, and I feel it's critical.
We didn't get directly affected by that Medicaid freeze in 2013. However, we did hear about it from our callers. Things like not being able to see a therapist in time, to not being able to access their medications on time. Big gaps in service as far as that goes.
We're in a behavioral health crisis in this state, and we've abandoned our historical roles in dealing with behavioral health or mental health. This infrastructure simply is not there. The bed space for inpatient treatment pales in comparison to the need. And then there's a lack of services for outpatient treatment. There really is no place to go. If you're suffering from a heroin addiction, where do you go?
I want the governor to know that resiliency is no excuse for abuse, because what happened with the system is abuse, and it needs to be stopped.
I would really appreciate if the general public got more engaged at all levels. Public funds are scarce, and we need to make sure that they're going to where they really need to go.
I think it's important for New Mexico to have a strong behavioral health system because it's at the foundation of our daily lives. If we're not healthy, both physically and mentally, we will not thrive as a state and as a country.
My message is to state legislators is to stop wasting money and help build shelters for the youth who get kicked out of their houses at like a young age.
I think we need a centralized database of providers, services, even the nonprofit agencies, some way to centralize that information so that the psychiatrists and therapists and anybody has access to that kind of information.
If we just had a little more investment in our system, in particular substance abuse treatment, we can save tons of money, turn folks into hardworking taxpayers instead of folks who are just constantly in and out of the criminal justice system. I mean, even if you're a cold-blooded person, it's cost-effective. It costs, $30,000 to incarcerate somebody a year, maybe $4,000 or $5,000 to treat a drug addiction a year. And so, to turn people into healthy human beings and working, tax-paying, loving family members as opposed to incarcerated persons, it's a win-win for everybody.